there's two things that I'd like to point out. Firstly, as you know, 2020 to 2021 New Year's was not a normal New Year's. They were not the parties like they were supposed to en masse. Yes, they were, but on a very different scale. The second thing is, when people came on holiday, it wasn't the same amount of people that we normally have. So we did anticipate that, but does that justify the drastic drop? Like you said, it was a peak and it was a sudden drop in the number of cases. What we also know that on the 22nd of December is that SAHPRA made the drug ivermectin banned. So it was illegal. And you know, the way they always say there's no such thing as bad publicity. So anything that's made public, and especially when somebody says this drug is now banned, more people are going to now say, why? Why is that drug banned? Let me go look at it. So 22nd of December, this happens. Suddenly, everybody in the world, actually in South Africa, is looking at what is this ivermectin that they're talking about? Why did they ban it? And then more and more people are talking about how it helped their families, how you can get it in the black market. So as much as there was a drastic drop in numbers, we know that the partying, the reveling, the return home, all of those factors were there, but there was also the factor of suddenly more people were using ivermectin. And when I say suddenly more, it was because of the publicity that ivermectin got. And yes, because it is now available on the black market. And I can't comment on that without actual facts, and I don't like to. But if you go on social media, and if you look at Instagram, Facebook pages, tons of people are saying, my family and I had COVID, or I had COVID, and these are the things I took. And ivermectin is there, ivermectin is there. They are allowed to talk about it because they're talking on their personal capacity. Remember, it's illegal for a doctor to prescribe. So we are waiting for studies that are done around the world. And if you take the studies that show that ivermectin can be used for prophylaxis, for early treatment, for middle of the disease, and towards the end, we know that based on studies. And then you look at the numbers. Then, of course, we have to say that it doesn't matter when the patient used it or the person who found it in the black market, when they used it. It doesn't matter because it would have contributed to the recovery faster and to the fact that they're not in hospital. So based on those facts, I'd like to say that it's multifactorial, but ivermectin is definitely one of the factors that have contributed to this rapid decline.
Why is there such a sharp difference of opinion between doctors on the ground that I must qualify is not stupid and most doctors won't do something irresponsible for their patients, but then on the academic side, people like Professor Karim and Dr. Angelique Coetzee saying no, but we can't use ivermectin. But there's such a lot of doctors that I talk to and have interviews with that say, yes, we want this, we need this. Why?
Well, unfortunately, the only certain thing about this pandemic is its uncertainty. And this follows on everything. It's opinions of people, it's the way things happen, etc. So say, for example, somebody is sitting in a research, for example, Dr. Angelique Coetzee. I'm quite sure I did an interview with her about 3 weeks ago on Power FM. And she mentioned in the interview that ivermectin is not on the WHO list of essential medicines. And this was just 3 weeks ago, and everybody knows that it's there. It's documented. You can Google it. So I would say that it's a lot of misinformation, firstly. And secondly, you have to look at it from the area that we're coming from. So, for example, if I'm a doctor treating a patient is sitting in front of me right here. So this is my chair where I consult. Patient is sitting in front of me. I look at all the criteria. This is what I'm saying. This is the illnesses you have, symptoms. This is how I'd like to treat you. Okay, I want to give you Panado because that's going to help you. Panado, you can buy it at Discount. You can buy it at Clicks. You can get it. You probably have some at home. That's what you should take. Quick. That's how we would work it out because that is how I've been taught. That's my training. Look at somebody else like Dr. Angelique Coetzee or Professor Karim. They're going to say, wait a minute, you want to give the patient Panado. Oh, but is Panado the right drug? Let's look at the studies, etc., which is all well and good, which I appreciate because we all have different roles to play. But like I said, in a pandemic, the only certain thing is its uncertainty. And if I'm saying, based on my experience, in this uncertain times, I'm saying that Panado is working really well for this particular patient. Why do I need to justify to you because you're telling me that I mustn't give it because it's not safe? But I'm like, hold on. This is on the WHO essential drug list. It is a safe drug. It's been used in South Africa for other things. Why are you creating an opposition? Is it because you want a protocol to be followed? Then let's not be hypocrites. The vaccine that's now coming in, we are not anti-vax, by the way. I want to just state that on the record. We are not anti-vax. But this vaccine that's now coming in, this Johnson & Johnson vaccine, is not registered in South Africa. Ivermectin is not registered in South Africa. They are applying for emergency access use, which will take 12 weeks. They have never even considered that for ivermectin, even though ivermectin has been around for 40 years. What about the fact that the quickest way to get it out there to the public is to do a trial? SAHPRA refused to do a trial. They said that we must apply to do a trial. But now, who's doing the trial for the J&J vaccine? It's SAHPRA, and it's the government. And by next week, these vaccines are going to be out there for the healthcare workers to take. But we as healthcare workers who are going to be taking this vaccine are not taking it as a choice. We are taking it as participants in a trial. So they're saying to us, not enough data for ivermectin. They know there's not enough data for the vaccine. Why not do the same thing? Very quickly you roll it out. Very quickly the vaccine is here because you're saying that there's a chance that it's going to help. But you don't know because the studies have shown between 57 and 60% efficacy in this new strain that we have, but we don't know. We're showing a higher efficacy in studies with ivermectin. So if you're doing this for the vaccine and you're saying that there's protocol to be followed, follow the same protocol with ivermectin. Why is it different? Why is a doctor not applying for a Section 21 8-page document to give their patient the vaccine because they think it's the right thing to do? Why is government making one decision and giving the doctors the chance to make the other decision, but making it so difficult to get the drug? Let me tell you this. My receptionist spent the last 4 hours trying to get ivermectin by the correct sources. Today, with all the changes that happened with SAHPRA, I just asked her now before I walked in here, I said, Mel, do you have ivermectin for the patient that we want to give you to? She said, yes, doc. So I said, where is it? She said, in Bangladesh. Those were her words. It's in Bangladesh. You tell me now. And this is today, right now. I can call her in here. She's been trying the whole morning. All the places we're supposed to access the drug from, it's there. So in public, everybody thinks SAHPRA is doing their bit. Yes, they are. But look at it properly. I'm saying to the people, look at it properly and look at the process. Is it reasonable? Is it realistic? And when we talk about saving lives, we're not talking about numbers and sitting on the top there in our ivory towers. We're sitting in front of the patients who are dying. This morning, we got a message one of the doctors in our group died. Yesterday, I got a message that another doctor died. The day before, I got a message that another doctor died. People are still dying.
Jou winkel, vars gestig in 2020, is hier om jou lewe op te kikker met al die beste produkte op jou vingerpunte. Sniffel, bestel, betaal en sien daar jou gunsteling produkte word by jou deur afgelewer. Ons is trots Suid-Afrikaans, trots Afrikaans en trots dat jy ons ondersteun. Ons behoog altyd om die beste produkte met die beste kliëntediens te lewer. Dis jou produkte, dis jou winkel.